As we close out the conference, I want to share a few of my thoughts regarding our healthcare system and the future of healthcare and the inevitable changes to come. To start off, one of the things we do here at the Pepperdine Grazia Dio Business School is study not only healthcare, but the business of healthcare. Because healthcare is a business that represents almost 25% of our economy. Let's recognize that there is a tried and true rule in American industry that overly expensive and underperforming businesses will be disrupted. And the American health industry, the American healthcare industry, sits squarely in the crosshairs of that. Disruption is taking hold of healthcare, with major health systems, payers, drug manufacturers, and technology companies increasingly making their presence felt. In the race to transform care delivery, reduce healthcare costs, and improve access to meet consumer expectations, this is a defining moment. Healthcare has been on the verge of transformation for many years. The last great force for change was the Affordable Care Act. The central disruptive purpose of the ACA was to make healthcare available to everyone in the United States, regardless of income level. While accessibility is an important part of the plan, one of its biggest mandates is to shift to value-based care and move to a preventative approach to medicine, rather than treating the consequences of falling ill. We see evidence of these mandates in play as payers increasingly move to value-based purchasing agreements. Employers are now offering financial incentives tied to their wellness programs, and we see a significant focus on improved and expanded availability of electronic health records. Even with the ACA's disruptive changes, the United States has what is arguably the most complex healthcare system in the world. As a result, changes within the industry can be slow. However, as we heard today, in a matter of months, another catalyst of change occurred. The COVID-19 pandemic broke down long-standing barriers and accelerated change across all aspects of healthcare at a pace few could have imagined. COVID-19 demonstrated that even in an exceedingly complex industry like healthcare, change can come quickly when it's necessary. Innovation, urgency, and necessity were the key drivers that sparked transformation in the face of the pandemic. Our speakers discussed some of these changes, and I would like to highlight and also mention a few. For example, the use of telehealth skyrocketed, and many think it's an innovation that's here to stay. Patients like the convenience, and for many conditions, it's an effective alternative to an in-person visit. Telehealth is a solution that addresses multiple issues that health systems are trying to resolve, like patient access, more affordable care, clinician shortages, and geographical disparities. I believe Dr. Siegel was spot on when he said that it provides the infrastructure that makes value-based care and population health initiatives work. The second area is about COVID forcing increased collaboration between the FDA and drug manufacturers, for example. The highly interactive emergency use authorization process enabled manufacturers and academics to advance diagnostic tests and validate new drug products and deploy them within weeks and months rather than years. Many see this as an opportunity for the FDA to improve the drug approval process, as there are several diseases and conditions that could benefit from emergency use authorization and expedited FDA approval process. We also witness unprecedented collaboration amongst drug manufacturers, fostered by the COVID pandemic. This approach brought together the best minds in the industry and compressed into months the search for a drug or vaccine and subsequent clinical testing that typically takes decades. The scale of the effort led to a vaccine in 6 months as compared to the current record of 6 years for the Ebola vaccine. Has this pandemic opened the door for improved partnerships between drug manufacturers? If collaboration can achieve these results in a crisis, Could it do the same against other diseases like cancer and Alzheimer's disease? Could a cooperative industry be more productive than a competitive one? I personally believe we will see a new and aggressive chapter in collaboration, but still have an environment that rewards companies for the risk and the investment they make to create these miracle solutions. What about healthcare consumerism? As COVID continues to impact the healthcare industry, it has challenged consumers to take control of their health more than ever before. They are learning about healthcare risks, communicating with their doctors in a new and different way, and changing their attitudes about data privacy. Each of these factors has a significant influence on how patients are interacting with the health system. Going forward, how will these events and factors change healthcare consumers' behavior? Are we more or less likely to see empowered healthcare consumers? I think the next great wave of preventive healthcare will come from wellness education and wellness coaching. Furthermore, more patients are using technology for health monitoring and are willing to share their data. A growing number of patients are using technology to monitor their health, measure fitness, order prescription drug refills, and even transfer and store their personal data online or in the cloud. Prior to COVID, there was some reluctance to share personal data. However, the latest information indicates patients are now more comfortable sharing data during a crisis and even post-crisis. So how does this impact health systems and providers? As healthcare becomes increasingly digitized, connectivity and interoperability become more and more important. Notwithstanding advances in health information technology, interoperability in the healthcare world is an area that needs to improve to benefit the providers and especially patient wellness. Health data connectivity remains a problem for clinicians. Despite the prevalence of digital technology records, most technology vendors don't easily exchange patient information, as we discussed during the symposium, making it hard for providers to use electronic healthcare records to improve patient care. Recently, CMS passed the Promoting Interoperability Program requirements, which will incent providers to continue to promote electronic exchange of information. As options for sending and receiving health information increase, health information exchange is critical for improving interoperability. Technology like cloud is making it easier and easier to store, retrieve, and analyze massive amounts of data. The market has also seen a significant shift in procedures and services that have historically been performed in an inpatient hospital setting, now moving to the home or alternate sites of care. As patients experience the convenience and accessibility of outpatient care, demand has grown. Ultimately, this trend is being driven by three factors: an emphasis on driving down costs, the rise of the healthcare consumer's preference, and an aging population. While COVID-19 has accelerated the interest in ambulatory or home care, this shift began long before the pandemic for several reasons that include convenience, efficiency, and cost. While hospital care is still the largest segment of the healthcare market overall, a disproportionate share of growth is coming in upcoming years and will be in the ambulatory setting. In fact, ambulatory care is one of the fastest growing segments of the healthcare industry, with home infusion forecasted to be the fastest growing segment of ambulatory care, more than doubling in size in the next 7 years. You can now receive high quality pharmacy care in the comforts of your home. Another element driving growth in the ambulatory market is payer pressure. The growth of at-risk contracts and value-based care are creating new incentives for providers and payers to find the lowest cost sites of care. An area that will also change drastically in the very near future is how the PBMs, pharmacy benefit managers, will react to an inevitable change to their current system. Instead of simply establishing a strict drug formulary to reduce cost, I believe they will begin to use technology to work closely with providers and value-driven pharmacies to treat patients in the best setting that will increase adherence, allow patients to stay connected to their caregivers, and finally, establish true integration for care. Payment for pharmacy value and quality of care-driven results will happen. The 3 largest PBMs control the vast majority of our country's prescriptions, so they will be the key to the next disruptive force in pharmacy. An integrated value-based system would rest and provide a result in savings for the payer, the patient, and additional funds will go to the providers of care like hospitals, doctors, and pharmacies. Let's face it, change is a constant in healthcare. Businesses that focus ultimately on the patient and the quality of care while increasing access to all and decreasing cost will win. Businesses that do this create the disruptive change we need. It will be exciting to see what the next chapter brings. I hope you join us next year to find out.